So my name is Christy Morrison. Today I'm going to be performing a comprehensive foot examination on a foot of a diabetic patient. It's important to do this on a yearly basis. So the first thing I'm going to do is just start with observing the foot. I'm just going to look at the foot, the outside of the foot, to make sure I don't see any deformities, make sure that I don't see any hammer toes, any calluses, make sure that the skin color and temperature is all uniform, no extra cold spots or any spots that are extra warm, and I'll check bilaterally to make sure one foot is not warmer or colder than the other. If there were any hammer toes, I would make sure that those were treated, any calluses, because those put extra pressure on the toe and when they're in the shoe or walking, so we want to make sure that those don't form ulcers. The next thing I'm going to be checking for is equinus. Equinus would be if the ankle cord would be very tight, and so the patient could not flex his foot forward. He could not go past a 90-degree angle, which this patient is fine. That just causes, if the patient were to have equinus, causes more pressure on the foot since they cannot bring their foot back to release pressure. So we want to make sure that they don't have that to cause more pressure. The next thing that I want to make sure is that the patient's metatarsals are not plantar flexed. And this patient has a nice even metatarsal line. I can flex the metatarsals, but they come right back into position. So if they were flexed, that would just again cause more pressure on the sole of the foot, which could cause ulcerations, which would lead to possible amputations if not corrected. I would also just be checking the foot, which I did when the patient came in, to make sure that the patient was walking okay, had a normal gait, didn't have any pain when they were walking, making sure that I didn't see any amputations here. If there was a toe that had been previously amputated or a previous ulceration, patients tend to form ulcers in the same place where they previously had an ulcer, or also if they had an amputation in one toe, that would cause more pressure to be placed on the other toes or other parts of the foot, which pressure can cause calluses, which can cause ulcers, which can lead to amputation. So it's very important that you note those and take care of any problems like that. When I'm observing the skin, I'm going to be looking to make sure I don't see any discolorations on the toes. I'm going to look in between the toes for excess moisture, any discolorations or yellowing of the nail bed, which could be caused by fungus or tinea pedis. If there is any discoloration, which this patient does have some yellowing and thickening of the nail, we want to make sure we treat that with an antifungal. Any problems with the nail bed or ingrown toenails could cause ulcerations in the toe, which because of diabetes there would be poor wound healing, and the patient could get an ulcer or a wound from that, which would need to be treated right away to make sure that it does not cause any need for an amputation. The next thing that we're going to be looking for is for our sensory on the foot. We're going to be making sure that all of our circulation is correct and intact by checking our pulses. So the first pulse that we're going to be checking is the dorsalis pedis, which is at the top of the foot, and that's a 2+, which is normal. Then I'm going to be checking for posterior tibialis, the medial posterior ankle, which is 2+ as well, so that's a normal pulse. Looking at the skin tone and cap refill, that's less than 2 seconds. All of those are indicators of good circulation that we want to make sure circulation provides for good wound healing and for good sensory, so we want to make sure that that's all intact. When talking about sensation, we're going to be checking for our sensation using a monofilament. So what I'm going to have the patient do is close their eyes, and then I'm going to check the patient's foot in 5 spots, and I'm going to be putting good firm pressure with the monofilament to make sure they feel that protective pressure on the bottom of the foot. So if you'll close your eyes now, and then I'm going to be touching, and I want you to let me know when you feel it. Okay, good. So the patient's protective pressure, he can feel any sensation in the sole of his foot, which is good to make sure that he feels that, so that's a good protection measure against getting an ulcer. The next thing that I'm going to check is vibratory sensation, and I'm going to be using a tuning fork for that. So what I'm going to do is I want the patient to tell me when he no longer feels the vibration and that he should feel it as long as I feel it. Tell me when it stops. Okay, good. So he should be able to feel the sensation as long as I'm feeling that. That just means that his vibratory sensation is intact, so that he's not had any nerve damage there. I'm also going to ask the patient to close his eyes again, and I'm going to test feeling for either soft or a rough edge. So if you can tell me if it's soft or rough.
Soft. Hard. 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 Soft.
Good.
Soft. Hard.
Good, good. So the patient's sensation is intact, and so that, again, we're just checking to make sure that all of our nerves are intact. I'm also going to be checking the reflexes. This would be, if the patient's reflexes are not intact, this could be a sign that we've had nerve damage. So I'm going to be checking the reflex of the back of the heel. Good. So the patient has good reflexes. And all of these things I'm going to be checking bilaterally in each foot to make sure everything is intact. Now, as this patient has had a normal foot exam, but since he does have diabetes, I'm going to be asking him to check his feet daily, check the inside of his shoes before he puts those on, be checking every day when he comes home, looking at all of the sole of his foot, to make sure that there are no wounds that he cannot feel. Make sure that his cap refill is good, which they can check individually at home. Since there is maybe a little bit of yellowing today, I'm going to be prescribing an antifungal, and once the course of treatment is done, I'll have him come back so I can check that and make sure that it's resolved and that we don't need to do any further treatment. All of this, again, is just to avoid any possible ulcerations. Otherwise, with a normal foot exam like this, I'll have the patient come back once a year, and we'll do a comprehensive foot exam like we did here today. If there were any problems, I would at least have him come back every 6 months so that we could continue to check that and treat any problems that there were. And again, as the patient is doing daily foot exams, if any problems arise, he would need to come in sooner so that we could treat those problems. So here, this is a comprehensive foot exam. Thank you.